Okay, now before I start this video, I want to let you know that whatever you're going through right now, you're not alone in this. It may be very lonely, very difficult, very stressful, but you got this. You got this. And I'm sending lots and lots of love and prayers your way. Okay, let's dive into this. I thought maybe it's helpful for you guys to know what the coming episodes will be about. So let's start at the beginning. Like I said before, it's been a journey of something 9 to 10 years. I want to let you know where I was, where I am right now, and what happened in between everything. It will be a short video because I will dive into the different aspects in different episodes. To start at the beginning, the first thing I had to deal with was a ectopic pregnancy. It was very shocking. First time pregnancy, emergency surgery, everything drama, and very scary. I didn't know what to do, what to expect. Ectopic pregnancy is a pregnancy that's developing somewhere it's not supposed to be developing, and most of the time it's in your tube or your ovary, sometimes in your deep in your uterine lining. They have to stop the pregnancy because it will be very dangerous for the mother. So in my case, I had the ectopic pregnancy in my tube, my left tube. So yeah, that was a tough one. After that, I had a blighted ovum. For me, also new. I didn't know something like that existed. It was like, huh? I didn't know anyone who had something like this. So I was like, maybe we're too early, maybe it will grow, maybe we're too fast with everything, let's wait. But it isn't growing. The baby isn't growing, or there wasn't a baby to start with in the first place. Something happened in the development and only the sac grew. That's not good. No bueno. And this time I didn't have surgery. I had pills to remove it. After that, or not exactly after that, is a bit during that also, I saw that my period started changing in the way that I had more pain, severe pain, and every month I will get more and more pain. I went to the doctor to let them know, like, I don't think that this is normal, I want to get checked. And they were like, oh yes, but maybe birth control helped with the pain, and they didn't want to do extra things to know what's like really happening. During my nursing classes, we had some information about endometriosis, but it was long ago, so I already forget. But when I read about it, I was like, hey, yes, a lot of women suffering from this condition, and maybe that's what I have. But why is it developing now? Because before this, I didn't have anything, no pain. I was the kind of woman that even forgets that she's on her period. Also, not a severe bleeding or something like that. No. So when it started changing, I was like, this is not me. This is not normal for me. So I asked the doctor to give me a prescription for a specialist. So she was like, why? And so I use my nursing skills and tell her, like, I have to do this because it's not normal for me. So she said, okay, you can go to a specialist. And I went, and he was like, yes, but if you want to do this, maybe you have to think about your fertility because you're already reaching your 30s, and you know how it is for women. Very bad thing to do to someone who's not even thinking about having children. So I had a bit of guilt. I felt guilt, and maybe he's right. I know that I knew that he wasn't right, but I was like, yes, maybe in the future, if I can get children, maybe it's indeed my own fault because I didn't have them when they told me to. Yeah. he was like, okay, we can look, check, because endometriosis, you can only get a definitive diagnosis by a surgery. So I had surgery to check if I had endometriosis, and they indeed saw endometriosis on the front of my uterine, the back, and on my colon. So they were like, you have endometriosis and it will impact your fertility. So I was like, I stopped everything. I stopped going to the doctor. I was like, I can't have this right now. I don't want kids right now. I have to think about what the next steps are and what my chances are, what I will do, and what's the best thing to do. And I did nothing for like years, and my pain became more and more and more unbearable. I couldn't go to work most of the time when I was on my period. It was very, very stressful and very painful for me. Yes. Then I decided when I couldn't take the pain anymore. Painkillers wouldn't help, and it was very, very difficult. I decided to go again, and this time, because this time I was indeed close to my 30s, I was like, okay, I don't want children at this point in my life, because we were very happy with our life the way it was, and maybe it's better to start thinking about it before it's too late. So we went to the doctor. We said, I want to do something about the endometriosis and maybe think about fertility. So he said, okay, I will help you, because you've been at this point we haven't been preventing pregnancy. It's not like we want to have a baby, but we didn't prevent it also. So, but it didn't happen also. So it was like years go by without protection, but we had no pregnancy. So at this point, I wasn't like really scared or something, or like if it happened, it happened. If it doesn't, it doesn't. Fine. So when we went to the fertility clinic, the doctor was like, okay, we will check everything, and they check everything, and my husband, everything was fine. So before we can even start, we have to think about endometriosis surgery. So I had surgery to get the endometriosis removed. So they remove a bit on my uterus, the front of my uterus, and a bit on the tube that was left. The only one. I had a bit of endometriosis in the tube, so they also removed that. So I could start with the fertility treatments. The endometriosis, the surgery went perfect, everything perfect, and the next month I was pregnant. The next month after the surgery, I was pregnant. I was like, whoa, okay. You people could have warned me that if you do this operation, you will get pregnant. Like, okay, they couldn't know, but okay, I was pregnant. This ended up in a miscarriage, 7 weeks, and yeah, so we moved on with the fertility treatment, because at this point we know that okay, there's something wrong, because at this point I had already had 3 miscarriages. After that, I got IUI. IUI is intrauterine insemination. It means that they put the sperm cell, the perfect sperm cells in your uterus to fertilize the egg. And if you're lucky, you will get pregnant. And if not, yeah, then you will try again. But every time it doesn't work or you didn't get pregnant, your chances of getting pregnant become very low. And after the first IUI, I also had a miscarriage again. So I was like, nah, Okay, we have to look why this is happening again to me. I want some blood work. I want you guys to do research. So my blood work came back positive for antiphospholipid antibodies syndrome. So I had these antibodies in my blood, and one time isn't enough. You have to do it again in 12 weeks. So after 12 weeks, I did it again to get a definite diagnosis. And after 12 weeks, my blood work came back positive again with these antibodies, and I got a diagnosis antiphospholipid syndrome. It's a syndrome where your blood clots, and in my case, during pregnancy. So when I get pregnant, embryos start developing, my blood starts clotting, and it prevents the embryo to get the right nutrients and blood and everything. So it's not good for the embryo. Some people also have this syndrome, this antiphospholipid syndrome, and also get clotting besides of pregnancy. So without pregnancy, they also get clotting. I never had any clotting or any problems before pregnancy. The only reason they know I have this syndrome is because I have multiple losses. So that's the criteria in my case. And multiple losses before 10 weeks. That's also important. After the diagnosis, I got a blood thinners, hoping it would work, and the pregnancy will develop perfectly, but it didn't. So I had a miscarriage, very early miscarriage again. And after that, I had one more time. This time it was very bad. I had another ectopic pregnancy, and this time in the other tube. So yeah, that's my story. And the tube had to be removed, or it didn't have to. I chose to get it removed. I will tell you more about this in a different video. So as you can hear, I had a long story. I had a lot going on, and I'm grateful for my level of handling stress, of stress tolerance. Because it was very difficult. Every time there's something and this and that, and it's very difficult and very stressful. I will tell you more about every single one of the miscarriages. Maybe you can relate to your own story, and it can help you in some way. Thank you for listening. Thank you for liking, for subscribing, and see you in the next video. Bye.